Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Proteus species under the section of infectious diseases. So this is the slide showing a picture of Proteus mirabilis. As we said earlier, it is not common for the MRCP exam to be asking you about histology or microbiology slides, but it is a good practice to know these because they are still within their rights to ask you these slides, especially as part of the written exam in part 2. So the epidemiology of it is that it colonizes gastrointestinal tracts. It is quite prevalent in the high-risk populations, and those are individuals with long-term catheters, urinary tract abnormalities, and in the elderly. It is also a cause of nosocomial infections. The pathophysiology of it is that it is a gram-negative rod-shaped bacteria with flagellated motility. The urease activity is important for pathogenesis of urinary tract and kidney infections. The clinical manifestation of this is that it can frequently result in struvite kidney stones, which are caused by urease producing Proteus bacteria, which is associated with urinary tract infections. Less commonly, it could sometimes also infect the wounds, respiratory tract, and as a result of that, result in sepsis. The management really is guided by susceptibilities. Their resistance is common due to productions of ESBL. Let's do some questions. A 68-year-old man with a benign prostatic hyperplasia develops urinary frequency, urgency, and flank pain. Ultrasound reveals renal calculi. Urine culture grows Proteus mirabilis. Which characteristics of Proteus mirabilis is most relevant to the formation of renal calculi in this patient? Option A, production of endotoxins. Option B, motility due to flagella. Option C, urease production. Option D, lactose non-fermentation. Option E, gram-negative bacterium. If you were paying attention, you would realize that the key factor that results in Proteus mirabilis making struvite renal calculi is its ability to produce urease. Therefore, option C is the correct option. Thanks for listening to this episode of Bite-Sized MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.